All right, Justin Timberlake has been battling some health issues. In fact, the pop star says he was recently diagnosed with Lyme disease while on his world tour. In fact, this is having a lot of impact on a lot of big names. Justin Timberlake, just to name one other who has been suffering from the same disease. So what do we need to know about Lyme disease? Joining me now is medical contributor Dr. Payal Kohli, who is with us and becoming a regular on the show. Thanks for joining us. First of all, tell us, what is Lyme disease?
So good morning, Chesley. So Lyme disease is an infection caused by a bacteria called Borrelia burgdorferi, and it's basically transmitted through deer ticks. So think about going camping out in the woods and you get a deer tick that attaches to you, get this infection. And it has sort of three phases. In the first phase, which usually happens a couple of days to about a month after, you get like a flu-like illness. But what's classic about Lyme disease is you get this bullseye rash. So a rash that looks red with central clearing, but you can get swollen lymph nodes, you can get fevers, you can get chills, muscle aches. So many of us might even blow that off as just having the flu, but it's that classic rash that really tips us off. Some people go on to the second stage where it starts to have neurological symptoms like Bell's palsy. You have paralysis of the facial muscle. You can have numbness or tingling. You can even have meningitis type symptoms like stiff neck and headache. And rarely do people progress to sort of the third stage, which is if it's not treated early on, then you can start to have problems with the heart, chronic neurological problems, and joint aches or pains.
All right. So you said it was camping typically, right? Where you're out in the woods and there's a lot of ticks out there. We don't know whether Justin Timberlake was out in the woods. He's saying it was after his tour. Is this a common thing, even if you're not in the woods, for this to happen?
So I would imagine that Justin is probably describing more of the chronic phases of Lyme. So there is a phenomena called chronic Lyme or long Lyme, almost like long COVID is how I want you to think about it, where the infection is cleared, but you have persistent symptoms afterwards. And we're not sure if it's inflammation that causes it or what exactly causes those persistent symptoms. But for a lot of young people that have had an infection, cleared the infection, may or may not have been treated. It's more common if it's not treated. They end up having long-term symptoms like brain fog, excess fatigue, neurological symptoms, very much like long COVID that could potentially interfere. So it's hard to speculate exactly what phase Justin is in. There's obviously a situation where you could have involvement of the heart muscle as well. Rarely can you die from Lyme disease, but when it involves the heart muscle, that's something called heart block that can occur as a result of Lyme. You could need a pacemaker or what have you. Again, it doesn't seem like those are the symptoms he's having, but it could potentially be that long Lyme or chronic Lyme that he's experiencing.
Is there a way for us to prevent it?
There is. And so, if there's no vaccine for humans, thankfully there is a vaccine for dogs. So if you're taking your dog camping or out in the woods in areas where there's a lot of Lyme disease, you may want to talk to the vet about getting vaccinated. But for us humans, we have to do a few things. First is to wear those mosquito repellents and the, tick repellents that have DEET in them. So 20 to 30% DEET. Wear long sleeves. Now the tick has to attach for 24 to 48 hours to actually transmit the infection. And the tick bite is usually not painful. So people don't know that they've been bitten by a tick. So when you come in from outside, it's really important to do a tick check, which is to take a magnifying glass, because they're about the size of a poppy seed, and look very closely and make sure there's no ticks attached, because if you pull it off with tweezers, you can essentially interrupt the process of transmission of the infection. And then, of course, if you do get an infection or you get a tick bite and then you have some symptoms right afterwards, it's really important to go see the doctor, because antibiotics can treat that early, and most people will recover completely after antibiotics.
All right, Doc, really appreciate all the insight on that. We'll see you again soon, okay?